If you are finding yourself frustrated from having to use eye drops every day due to glaucoma and you're over 50, then our next guest has a clear solution for you. Dr. Jeffrey Whitman of the Key-Whitman Eye Center is here to share more on the new options designed to lower eye pressure for glaucoma patients having cataract surgery. Good morning. It's so nice to see you.
Great to be here this morning.
Thank you, Dr. Whitman. Okay, for folks at home who are unfamiliar with this, could you just briefly explain what glaucoma is and how it may affect your patients?
Well, Jane, glaucoma is a disease of painless increase in eye pressure that can damage the optic nerve at the back of the eye. And the serious message here is that glaucoma, if left untreated, will lead to permanent loss of vision.
Okay, so what kind of treatments are available for glaucoma?
Well, traditionally, we really relied on the use of expensive prescription eye drops that often had to be used several times a day. The good news is that today we have microscopic implants that we call stents that can reduce the use or get you off of those drops altogether.
And they are just tiny, 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 tiny. I know you've showed me those before. I'm always impressed with when I see medical technology that's really able to help people. So talk about these.
Well, and as you can see on the screen now, we have actually two different type of microscopic stents we use, the iStent inject, and we have the Hydrus stent. And they're both, again, microscopically tiny, they're painless to put in, but the important thing for our glaucoma patients to hear is that insurance only pays for them when you have them placed along with your cataract surgery.
Oh, okay.
So you have a once-in-a-lifetime opportunity to reduce or get off of those glaucoma drops. So when choosing your cataract surgeon, you really need to be sure to ask, will you put the stent in at the same time as my cataract surgery? Most do not. At Key-Whitman, we do.
Okay, I know one of the big problems that people face, we all know how expensive prescriptions can be. So if someone's watching, how do they find out if they're a candidate for a procedure like that?
Well, first of all, Jane, you're right. The drops are expensive. You often have to use them several times a day. That's why patients want off of them. And the easiest thing to do is get on the phone, or you can get online and set up that evaluation. We have 9 offices across the Metroplex. My team and I are at the headquarters office in Dallas, office 75 North Central, between Royal and Forest Lane. And when you come in, we'll get you evaluated, see if you're a good candidate for the stents or perhaps one of our other advanced glaucoma treatments.
That is great. And it's got to be really, I mean, as a person who treats eye issues, it's got to be really gratifying to see how new things like that can really help people.
Well, you know, it's funny that my sister-in-law, who we did one of these procedures on, she kind of poo-pooed that she saw lots better after her cataract surgery, but that she doesn't have to use the drops now. That's all she talks about.
That's great. Okay, thanks, Dr. Whitman. We really appreciate your time today. Key-Whitman has 9 locations all over the Metroplex. To schedule an appointment, here with what you do, call 214-220-3937 or just visit keywhitman.com.